I'm going to go a little off topic before I jump into my subject. They asked me to talk about big data, and I guess they say I'm in a C-suite. We'll talk about, I'm hopeful that I'm going to be able to tell you my perspective on big data, but before I do that, a week can change somebody's life dramatically. I was looking at my watch and going, exactly a week ago, I found myself in a small room in East Block with 10 other people. And yeah, I was there when this whole thing went on, and I got 12 hours to think about what it is that I do for a living. And I think to Jonathan Goodman's point this morning, I think we're very fortunate to be in the business that we're in, and I think it's up to us that we have to do everything that we can to ensure that we're delivering our products to patients, and I think that's the most important thing we do. So I wanted to say that. So, you know, so big data. I started thinking about this, and I've been in the business a long time, and big data for me when I started in the business was if I could get to the phone booth first and rip out the pages, the physicians and surgeons pages, that was big data. That was my call list. And I thought that was big data. I went, great, I've got a call list now. And things have changed, thankfully, over the years. You know, the phone, actually, you don't see a lot of phone booths anymore, so I don't know where we would get that data. But things have come along and big data has really changed. And as I was thinking about the subject, big data means different things to different people. And I started asking people what they really, you know, what it meant to them. So I'm going to ask you, what is it, you know, what does the term big data mean to you? So obviously it looks like it's a combination of all of those things. Call activity data, certainly IMS Brogan data, private provincial data that we have access to, and clearly I'm going to speak a little bit in terms of US-based provider data. I do have one more question I wanted to ask, and future of big data use specifically here in Canada. Again, I wouldn't mind your opinion on this. So obviously everybody really does think that it's going to increase, and certainly we heard the previous speakers talk about the importance of big data. So, you know, what's happened, and I think in our environment right now is really the perfect storm in terms of big data. There's this evolving payer business model. We're all impacted. I'm chair of the HTA committee for RX&D and for biotech right now, and obviously payers, and one of the slides before was, you know, how important payers are to our overall business model. There's a lot of providers that are integrating, and I mean, you know, things like wholesalers integrating with pharmacy chains and all of this, and we've heard a lot of it down in the US where you have these integrated health networks, you know, the Kaiser Permanentes of the world, the Armada, the Humana, and all of that. So there's a lot of this integration going on, probably less so in Canada, but we're starting to see that move from south to north at this point in time. Changes in the scope of practice. Obviously, there's a great deal of changes out there. Pharmacists, the ability for pharmacists to dispense, to prescribe, nurse practitioners. I think that's only going to gain momentum over, you know, the next coming years. So that has an influence, and obviously the increased use of technology, and that was mentioned before in terms of physicians and patients going out there and getting their information via the internet and other technology. And obviously the rise of the consumer. I think we're seeing more and more, and we hear it from our representatives when they see doctors, is that patients coming in and saying, this is the disease that I have, this is the therapy that I want. So they're taking a very active role, and if they're not taking an active role, if you look at oncology, the healthcare, you know, their family member is helping them in this journey as well. So we're seeing a number of major shifts, and really I'm not going to go through each one of these, but I did want to talk a little bit about, you know, the big data and perhaps as I see it, the challenges that we're going to have from a Canadian perspective. In the US, we're hearing a great deal about big data. Certainly our organization has set up a fully integrated strategic business unit that just calls on these major players in the US. And the beauty of that is that these integrated service providers, and I'm talking about Kaisers of the world, they follow that patient longitudinally, really over the life of that patient. It's important for them. So they look at this as, you know, if you're going to give a product or a procedure to that patient, they can actually measure the impact of that over time to see if it's cost effective, because at the end of the day, they're in it to make money. They still have to make some money. A little bit different in our healthcare system, and Ian mentioned that from a private payer perspective, that can happen. And certainly that is a possibility here in Canada. The problem is we don't have a single payer system in Canada, so therefore, from a healthcare perspective or a provincial perspective, they're not necessarily looking at it from an outcomes. They talk about it, but they actually don't measure it. And I think that's going to be one of our challenges. I think it behooves us to ensure that we're trying to do everything we can to make sure that we're moving this mandate forward, because if we're going to show value, we're going to have to show data. The problem right now is the provincial healthcare payers are really not in tune with what we're trying to tell them, because they're in a cost containment mode. They're not looking at it from an outcome perspective. So it's going to be, I think, a major challenge for us. I think it's going to be very difficult for us over the coming years. I think we're going to have to use every source of data that we have at our disposal, and we're going to have to find what's important to them, because they still don't know what's important. And so I think it's going to be a challenge for sure as we go down into the future. The stakeholders are all undergoing these value-based transformations from the payers, governments, prescribers, patients, and even sort of us in the pharma business. And we're being challenged a great deal, certainly by our parent companies, what it is that we need to do to be successful here in Canada. And I think at the end of the day, the only way that we are going to be successful is using every source of data that we have at our disposal. But again, I think the caveat to it, and I wish I was a little more positive, is if we could get the government payers, the public payers to truly take a look at this from an outcome perspective, because they don't look at it that way. I wish they did, but I don't see it certainly in my capacity. So real world data, I think that's going to be the future. There's no doubt. I mean, organizations, I was looking at some surveys last week, all the big companies have set up big data organizations within their organizations. And we're talking departments of 50 or 60 people and taking a look at this. I also was looking at some survey information from the integrated providers in the US, and they're very anxious to work with pharma. So we've got really two areas that want to work together, because they believe that if they can match up changes in whether it's prescribing or some intervention that's done for the patient, that there will be a positive outcome. And that's going to be important for us. How we're going to do that here in Canada, I think, is still up in the air. I think it's going to be one of those challenges, again, that we're going to have to find a solution to. And I think as an industry, we've always been challenged over the years. This is just another one of those things that we're going to have to address. So really, at the end of the day, our job is to drive and communicate that meaningful value. And as long as we do that, we're going to do the right thing, which is improve the lives of patients. So thank you very much.